And good afternoon. It is time for our regular lunch and learn, and my desk is full of research on various topics. But today I want to talk to you about what good health looks like. Now, in our current climate, you may say good health looks like the absence of an infection, and you would be right. You might say my blood work is perfect. And that's good, and we like that. But so often we have people come into the center and they say, Dr. Polly, my doctor says that I'm fine, my blood work looks fine, but I have all of these issues. So, how can that be when my blood work looks fine? Well, one of the things that you need to remember is that when you go to a conventional medical doctor, they're going to look at your blood work and they're going to look at it according to the reference ranges. Now, because our medical system is a disease treatment model, they are only going to give you something if you are in a disease process. Now, we look at your blood work from a much narrower reference range. It's narrow on the right, narrow on the left. And so we are looking at you when you trend into a disease. I've been spending some time today going through blood work for a new person that has come to see me, and I've got blood work from 2013 up to present. And so we're looking at that blood work to try and find out what the actual cause of her symptoms are, because she's just not getting any better. In fact, when I'm looking at her doctor's notes, every year, every visit, she gets a longer and longer and longer page of all the things that are wrong with her and all the medications that she's on. So clearly not a picture of health. But you might be feeling some things and your doctor says everything is fine, and you're a little bit frustrated because you don't feel fine. And so that's what we're going to talk to you today about. And this is from traditional Chinese medicine perspective. Okay, Chinese medicine has been around for thousands of years. I know a lot of Christian people are very skeptical about it, and you shouldn't be. It's herbs. That's all it is. It's herbs. It's traditional wisdom from years and years, and those herbs still work. All right. So this is a article that I'm reading, and it is by a licensed acupuncture, and she has written, it's either an article, I think it's an article, Simple Steps, the Chinese Way to Better Health. It was an article. It was published in Acupuncture Twin Cities. So that would lead me to believe that she lives in Minnesota. Can't promise you that, but that's, context clues there. So good health, she says, is a gift that many of us take for granted until it is lost. And I would just tell you that that is true. We walk, we talk, we move with grace and ease until we can't. And it's only when we can't that we really are, I should have paid more attention. I should have been more cognizant of the signs that something was going wrong, but that's just not always what we do. So some of the things that you may find that you can't do is you're not sleeping at night, or you can't sit down on the floor and then get up. You can't stretch. You can't do a simple sit up. Now, I do sleep well most nights, and I can get on the floor and get back up. I cannot tell you that it's pretty, but I can do it, and I'm grateful that I can do it. So in Chinese medicine, good health is all about flow. What is going through your blood vessels, what's going through your digestive tract, and even what's going on with your emotions. So we always want to look at that. Are we having a flow, or are we having to force things to get done? So we want to flow, not force. Now, in my center, in my office, where we're talking about this, we usually talk about drainage pathways. We talk about obstacles to cure. We talk about what is not quite right yet. And so we're going to talk about a little bit of this from a different perspective, from the Chinese medical perspective. So you are in good health if you are free from pain. Many people come in here with perfect blood work, and yet they are in chronic pain. So chronic headaches, aches that seem to change with the weather, or pain that lingers from old energies. All right. Along with the absence of disease, the absence of pain is also a good place to begin to define good health. We talked about sleep, A lot of times people come in and they have one of two problems. They'll say, Dr. Polly, I can go to sleep, but I wake up almost every night between the hours of 2 and 4. So if that's you, that is a sign of liver congestion. If you are a female of a certain age and you have hot flashes, that also is a sign of liver congestion. Yes, I know most people will tell you that it is hormonal, and it could be hormonal, but it also could just be that you have not flushed your liver in quite a while, and that's all you need to do. So some people can't go to sleep. Once they get to sleep, they sleep throughout the night, but it'll take them an hour or two to go to sleep. So that might be something that is attributable to being on your devices too late, watching television too late, blue ray, blue screen interferes with your production of melatonin, and that can stop you from having good sleep. So we need to make sure that we have downtime in the evening. We need to make sure that we set aside time for proper sleep hygiene. So what does that mean? That means not going to bed with too much alcohol, not going to bed too soon after you've consumed a heavy meal, not going to bed unless you've been off your devices for a good hour. Now, if you wear those glasses that block the rays from your screen, then you're going to be okay with that probably. But still, the electromagnetic rays from your devices in some people does contribute to poor sleep. All right. It says choose periods in your life when you're stressed or consumed by some project, school, work, family, or caregiving. You need to have a break. You need to give yourself a time out so you can process those things. So when you go to sleep, when you go to bed, your brain is not trying to problem solve. So we all know that. We even say, oh, I'm going to sleep on it. I'll give you the answer in the morning. And we know that if you have good sleep, that your brain will traverse through all the things that are going on, and you will have solutions, you will have answers, you will be able to problem solve, and that's a good thing. But if you are overstressed, and we hear this time and time again, my brain just won't shut off. And so if you take time throughout the day to process and decompress, you're going to find that you sleep just a little bit better. The third thing that she says is that you have got to appropriately express your emotions. So what is appropriate? Appropriate is, this is how I feel, calm voice, no accusations, no pointing the fingers, no getting agitated when you're trying to say how you are feeling. If you are not expressing your emotions properly, if you're not expressing your emotions in a way that people can hear, all you're going to do is turn the volume up, and you're going to create even more negative emotions. So there is an essential wellness that includes a life that has meaning, joy, gratitude, resilience, an open heart, and loving relationships. So what we see a good deal through our social media and in society at large is a sense of entitlement and a sense of things are not right and we're all going to hell in a handbasket. Well, that is exactly the opposite of gratitude. If you will focus your thoughts on gratitude, I have this and I'm grateful for this. Maybe can't do that. I don't want to major on that. I want to major on the positives, major on what I can do. Emotional health means that you possess the tools to deal with hard times and stressful situations that life throws your way. We all have hard times. We are all living in a stressful situation. But those people that are emotionally healthy are not twisting off. They're not yelling, they're not backbiting, they're not having emotional outbursts. If that's you, then that is a sign of poor health. That could be a sign of cortisol overproduction. It could be a sign of adrenal fatigue. It could be a sign of a lot of things. So check your emotions, because your emotions should flow. Yes, we all have bad days, and we should be able to say, hey, I'm having a bad day. I need a break. I need a hug. I need you to straighten up. whatever it is. Okay. We are not supposed to do is twist off and start a shouting match or a humiliation or whatever that may be. So if you have good health, you will have a good appetite and good digestion. Now, a lot of people do not have a good appetite. They say they don't eat, they don't get hungry. That is a sign of poor health. Why is that? Because your body needs fuel in order to function. You cannot drive your vehicle with an empty gas tank, and neither can you live a good, full life on an empty tummy with no digestion, with no nutrients. All right. So if you have poor appetite, poor digestion, then you're going to have some problems. Now, we talk all the time about your gut and your gut brain connection. There is what we call the ripple effect. Actually, I did not make that up. That comes from Transformation Enzyme Corporation. And I've shown you that picture time and time again, so I'm not going to bore you with that. But basically what it says that if you absorb your food, you digest your food, you absorb all the nutrients, then you're going to have health repair and you're going to be balanced in your body. And that means your brain waves, your emotions, and all that kind of thing. If you do not digest your food, you're going to not absorb your nutrients. You're going to have toxicity and inflammation. And from inflammation comes all kinds of sickness and disease. So one of our foundational programs here at the center is we reset your GI tract. Now, why do we do that? Because we know that if we can get you absorbing and digesting your food, that everything in your body is going to take a turn for the better. And so your adrenals are going to be better. Your heart is going to be better. Your elimination is going to be better. Your movement, your skin. I mean, skin issues are a direct correlation to a bad gut. So this lady says that most people would describe their appetite as too good. That means we eat too much and we eat the wrong things. However, it is possible to have a healthy appetite, eat healthily, but if your digestion is funky, right, it's difficult to have good health. So we talked about that. We need to make sure that we've got good gut health. So if you suffer from GERD, that is the acid reflux that comes most times from hypochlorhydria. What is that? That is low stomach acid. That is something that happens if you get to be of a certain age, and we'll say 50 and above. Most of the time, your medical doctor, if you suffer from GERD, okay, gastroesophageal reflux disease, okay, if you suffer from that, they're going to say, oh, you've got too much acid, and they're going to put you on a protein pump inhibitor or a different kind of drug that is similar in function. So what that's going to do is suppress your stomach acid. If you don't have enough stomach acid, which is hydrochloric acid, by the way, which is very, very low on the pH scale. I think it's a 1. It is how you digest your food, right? Your food goes into your stomach. Hydrochloric acid is there. It churns it up into little microscopic bits that go into the small intestine where your body absorbs it. If you've got problems in that area with your stomach acid, then you're not going to break down your food. So your food's going to be too big to be absorbed. So you're going to go to the bathroom and you're going to have just nasty toilet paper and all that kind of stuff. That is a sign you are not in good health. If you have a lot of gas and bloating, that also is a sign you are not in good health. You should not have gas. You should not have bloating. You should move your bowels 2 or 3 times a day, every day, and your toilet paper should stay clean. So those are all kind of things that you can look at with your gut health to see how you are doing. All right. If you want optimal health, then you will have enough energy to sustain yourself throughout the day. You won't be somebody that has to have a nap. You won't be somebody that has a mid-afternoon crash. Those kind of things are indicative of poor health. Your blood work may be great, but you're trending toward a disease if you do that. Now, honestly, if you nap on a day off, that's not really a big deal. But if you have to have a nap every day to function, that is a big deal. If you do need a cat nap, that's okay. We'd say 20 to 30 minutes. I'm not too worried about that. But if you consistently sleep over an hour nap every day, that is indicative of a metabolic disease. And so none of us wants to have a metabolic disease. And so part of good health is to make sure that we have enough energy to get us through the day. Now, and I'm not talking about drinking your monster drinks or drinking your energy drinks or having that 15 cup of coffee in the afternoon so you don't crash and burn, okay? I'm talking about legitimately having enough energy to get you through the day. Right? So if you have enough energy to get you through the day and you're not fatigued all the time, that is an indicator of good health. If you need a nap consistently, if you're napping for more than an hour consistently every day, then you are in a metabolic downturn, and we don't want to see that, okay? You need to have the element of movement. So physical movement is indicative of health. It is indicative of optimal health. Now, as we get older, people just assume that they're going to slow down. They assume that they're not going to be as active as they were when they were younger. Now, I don't particularly ascribe to that, although I have had some physical challenges as I have become older. But I'm not just one that's going to say, oh, well, I'm 60 now. Oh, well, I'm 64 now. Oh, well, this is just what happens. No, we're going to find out why. We're going to, consult professionals that can help us, because we want to get out of that process and we want to have that element of movement. In Chinese medicine, good health is all about movement. Good health through flow relates to the external factors such as your ability to change, your ability to try something new, and your ability to demonstrate flexibility. Like the element of wood, the ability to bend without breaking is a sign of good health. So you should be able to, as I said earlier, get down on the floor and be able to get back up. As I say, in my case, it's not pretty, but I can do it. You should be able to bend over at the waist and touch the floor. All right, that's a little exercise that you can do to see if you can do that. You should be able to do lunges. You should be able to pick up things. I mean, not heavy things like 50 pounds or anything like that, but you should be able to move and be flexible and do what you need to do. And so you want to work on that. And if you're not able to do that, then you want to seek the help of a professional that can help you do that. So if you've got muscle stiffness, if you've got muscle soreness, you may need to have some myofascial release, and we've got people that can help you with that. And so let me know if you need a referral for that so we can help you with that. And then you want to make sure that you're having the appropriate use of medications. She says, over the years, I've seen many patients who are taking 10 or more prescriptions every day. Okay. And additionally, numerous over-the-counter preparations. Can this be healthy? She says, clearly, there are many health conditions that are managed or treated by medications. And this is something that we know. We know that we might have medications because we've got a chronic disease. I'm thinking of high blood pressure. I'm thinking of diabetes. I'm thinking of any kind of chronic fatigue syndrome or anything like that. I'm thinking of rheumatoid arthritis, which again is an autoimmune disease. These things can be reversed. We've seen that happen here, and it can happen for you too. Now, is it easy? No, it is not easy, but it can happen. You just have to have the mindset, number one, that you agree that if you give your body what it needs, your body has what it needs to be able to turn the corner, turn the table, and be able to rectify itself. It's not necessarily a quick exercise, but I would certainly want to work on my body that way and get off the medications and live a healthy life than be, confined to the rigors of taking medications every day. One of the things about medications is almost all of them are made out of petroleum products. Well, that's not a good thing to be ingesting. And I'm not against medication. Sometimes we need it. When we're in a crisis situation, we need medications. Some of you that know me and follow my Facebook page, you know that my grandson was attacked by cat scratch fever. Yes, that is a thing. And the cat doesn't only just have to scratch you, the cat can lick you, and that bacteria can get into your body. So that can be through a cut in the skin, or they lick your hand, you wipe your face, or whatever. Normally, it's only children that get cat scratch fever. Normally, it's only kittens that give you cat scratch fever. But in his particular case, the bacteria went to his spleen and it went to his optic nerve, and it was causing blindness. Now, we are very, very thankful that we've got hospitals, and he was directed to go to the hospital and be checked out. And he actually was in the hospital for a week. And while I hate that he was in the hospital for a week, I'm very, very grateful that he was in the hospital for a week, because his vision is returning. Everything is getting better. And there were medications there that could arrest the situation, because it was a crisis situation, and bring him back to health. Now, of course, we've got things that we're also doing holistically to help clean up all the mess from the medications, but we needed medication because it was a crisis situation. So we do want to avail ourselves of medication when we're in that kind of situation. But if we treat our body the way we need to, if we're looking at all these signs, can I move? Can I digest? Am I sleeping? Am I without pain? All of those things point to us being in optimal health. Now, I've told you before that we had some people that come in and they have said their doctors said they're fine. They know they're not fine. And we do our evaluation and we find that, in fact, they are not fine. And so you want to make sure that even if your blood work is quote unquote perfect, no problems, if you're having any of these other symptoms, then you want to make sure that you get checked out, because you could be headed toward something that we don't really want. All right. So I want to leave you with this, that your health is your own personal responsibility. I can help you. Medical doctors can help you. You can go to stores and they can give you advice, but ultimately your health is your responsibility. What you don't know can hurt you. So when you go to the doctor for your annual physical, as hopefully all of us do, when they do your blood work and you go for your follow-up visit and the doctor says, "Oh, you're fine. Keep doing what you're doing. I'll see you next year." Ask to see a copy of your blood work. Number one, you paid for it. Number two, doctors don't always tell you everything that's on the blood work. We've had multiple instances where people have come in, they've brought me their blood work. I will ask them, "What did your doctor say?" Your doctor says, "I'm fine." My doctor says, "I'm fine." And when I look at the blood work, I see that there's protein in the urine. Did they give you an antibiotic? Because that's indicative of a urinary tract disease. No, they didn't tell me that. Urinary tract infection, not disease, sorry. I'll see where the white blood count is 7 or 8. It should not be above 5. On your medical reference range, your doctor's not going to give you an antibiotic until you're over 10 on the white blood count. We look at that. If you're over 5, maybe 7, if you're over 7, we know that you're headed toward that disease process, and we're going to give you and encourage you to do good natural antibiotics, good natural antivirals to arrest that condition before it gets bad enough that you're going to have to go to the doctor to get the medication. So always ask to see your blood work, because your blood work gives you a hint of how you are doing. Even if everything is fine on the reference range with your medical doctor, if it's not in optimal reference range, you're headed for trending toward a disease. What we do here in the center is we look at your blood work year over year and we compare. Even if you're in optimal range, we will address it if we see it going in a negative direction. Point in fact, we had a gentleman that came over. I think he's been with us for a couple of months. And one of the things that he did, he had some blood work done, I think in February, and it showed that he was in kidney disease. He then went and had the first of 2 injections, and you know what I'm talking about. And he found that his kidney numbers plummeted. Well, if you've been watching the news, if you've been watching the science shows that there are things that happens to our hollow organs whenever we have those medical interventions. And so when I explained to him that the downward trend on his blood work was a direct result of that medical intervention, he was very angry that his doctor did not tell him that that was something to expect once he did that medical intervention. So you're not going to necessarily get everything you need from just asking the doctor questions, although we do want you to do that. When my mom was diagnosed with a certain cancer, I did my research. I went with her to her appointment. I asked the doctor, are you going to do this particular protocol? And the doctor just kind of looked at me like I had 2 heads. And it's like, well, why would you ask? I said, well, because I want to know, because there are certain health conditions that cannot take this particular protocol. And he brushed me off and said, well, it doesn't matter what she's got. That's what she's getting. And, you know, that's really not a caring, compassionate way for a doctor to respond to a legitimate question. Everybody is different. Everybody is unique. The standard of care is not necessarily a one size fits all. If we understand that, then we're able to move forward. We're able to go be our own advocate and be responsible for our own health wherever that takes us. We might need holistic care. We might need medical intervention. I don't know what we're going to need down the road, but if we are aware, if we are mindful, if we are paying attention to all of these things that we talked about today, then we're going to have a heads up on that. It is the weekend. I want you guys to have a great weekend. Do a lot of self-care. Know that I love you very much. I'm so honored that you have spent this time with me today. If you have any questions, if you want to know any other information, pop the comments down in the box and we will help you, and we will see you next week. Take care. Bye-bye.